Welcome to Everyday Nursing Knowledge Lectures, and today we will learn about septic shock. What is septic shock? Shock is decreased blood supply to the tissues that leads to hypoxia, and if it happens due to sepsis, it is called septic shock. So what is sepsis? Sepsis is body's reaction to infection, which is highly extreme or amplified. As a result, system-wide inflammatory response is activated. When a bacteria invades the body or when an infection happens from a virus, fungi, etc., the WBC or immune system tries to fight this infection. As a result, chemical mediators are released, and this can cause system-wide inflammatory response. This response is called sepsis. Early identification and treatment of sepsis is very important because according to CDC, 1 in 3 people die in hospital have sepsis. And septic shock is the severe form of sepsis. Now let's see who all are at risk for developing septic shock. Remember the word sepsis. S stands for suppressed immune system. Patients who are on chemotherapy, HIV, AIDS, the immune system are suppressed and they are prone for sepsis and septic shock. Extreme age, example infant or elderly, are at risk. P stands for people who received organ transplant. They are on immunosuppressive medicine, which put them at risk for developing sepsis and septic shock. Surgical procedure, that is anything invasive, increases the risk of developing sepsis. Indwelling devices, example it can be Foley, central and tracheostomy, anything invasive increases the risk. Sickness, which is chronic, example diabetic, alcoholism, renal failure, liver failure, increases the risk of developing sepsis. Now, what are the original site or common site of infection in sepsis? The common sites are the sepsis can develop from lungs, example pneumonia. Pneumonia can lead to sepsis, septic shock. Urinary tract infection can lead to sepsis. Any bloodstream infection, which can be from a central line infection, lead to sepsis. Any abdominal infection, example abscess or perforated gut, this all can lead to sepsis and septic shock. Now let's see the pathophysiology of septic shock. Remember, septic shock is a distributive form of shock. What is distributive shock? In distributive shock, there is issues with the distribution of the blood, which occurs primarily due to vasodilation. And other forms of distributive shock are anaphylactic shock and neurogenic shock. So when infection happens secondary to bacteria, fungus, virus, the WBC or immune system tries to fight the infection. As a result, cytokines and other inflammatory mediators are released into the blood vessels. What happens when they are released? It causes vasodilation, that is, blood vessels dilate and blood pools to the extremities. It causes leaky blood vessels, that is, it increases the capillary permeability. As a result, plasma in the blood leaks to the interstitials or space between the tissues. So this too can cause a significant drop in blood. There is release of platelet activation factor. The platelets are activated. As a result, there is formation of blood clots, and this happens throughout the blood vessels. So when there is blood clot formation, the clotting factors are used to break this clot. As a result, this can lead to again bleeding and DIC. So remember, all these decreases the blood supply to the major organ, decreases tissue perfusion. As a result, this can lead to organ damage and death. Now, what are the stages of septic shock? When there is a systemic inflammatory response, the signs and symptoms are patient may have fever, can be temperature greater than 38 or hypothermia less than 36. Heart rate goes up, respiratory rate goes up. When respiratory rate goes up, the carbon dioxide drops, WBCs are either high or less than normal. And SIRS can always lead to sepsis. So you call it as a sepsis when there are signs and symptoms of SIRS and you are suspecting or a confirmed source of infection is present. If sepsis is not treated, it can progress to severe sepsis. You call it a severe sepsis when there is signs of organ dysfunction, which you can see by certain labs. Example, lactic acid greater than 2. What is lactic acid? Remember, in septic shock, there is decreased blood supply to the major organs, but the organ needs energy. So the metabolism takes place in the absence of oxygen. There is no oxygen to the tissues. When there is anaerobic metabolism happens, lactic acid build up in our body. So lactic acid greater than 2. When kidneys are affected, creatinine greater than 2 and low urine output. When liver is affected, total bilirubin greater than 2, hematological abnormalities, platelet drops, high NR and APTT goes up. Definitely hypertension happen, but it responds to fluid. This hypertension is due to vasodilation, respiratory distress when lungs are affected. Now, severe sepsis can progress to septic shock, and we call it a septic shock when it is associated with hypertension which is refractory. What is refractory hypertension? Refractory hypertension means hypertension does not respond to the fluid bolus. You give fluid bolus, patient remains still hypertensive. So you need medicines, example vasopressors, to increase the blood pressures. Also, lactic acid will be greater than 4. That indicates severe hypoxia. Then you call it as a septic shock. What are the signs and symptoms of septic shock? Definitely hypertension, because there is vasodilation, leaky blood vessels, blood pools to the extremities. Warm flushed skin. This is because of vasodilation, blood pools to the extremities and the skin appears warm and flush. But later stage, what happened? Blood is shunted to the major organs from peripheries. As a result, you feel the cold, clammy skin. This is a late sign. Fever, again initial sign. Hypothermia, because the blood is shunted to the major organs, so you may not get a temperature. So hypothermia in late sign. Your heart rate goes up, respiratory rate goes up. This is a compensatory mechanism. Body is trying to get oxygen. As the blood supply to the organs, brain decreases, patient may become lethargic, absconded, or patient may get anxious. And as condition worsens, if not timely management is done, it can affect the heart function. If kidneys are affected, decrease urine output. All major organs are affected. As a result, it can progress to coma and finally death. Now, what are the treatment of septic shock? Remember, if septic shock is suspected, draw initial lactic acid level. Why? Because the initial lactic acid or elevated lactic acid always correlated with poor clinical outcome. So draw an initial lactate, labs, and further test. Example, if you're suspecting pneumonia, and X-ray. So further test to rule out the source of infection. Cultures are ordered. Usually 2 sets of blood culture, urine, sputum. If wound present, send a wound culture, and this has to be done prior to starting the antibiotic. Now, IV antibiotic start as soon as possible, and it should be a broad spectrum antibiotic. Give fluid bolus. Remember, the fluid bolus helps to fill the dilated vessels and fill the circulating volume. And the goal is 30 ml per kg of fluid. The only concern is fluid overload. Example, if a patient on dialysis or congestive heart failure, maybe a limited amount of fluid volume is given, or else the goal is 30 ml per kg fluid bolus. And then you repeat the lactic acid every 3 hours times 2. That is at the 3rd hour from the initial lactic acid and at the 6th hour from the initial lactic acid. It determines the prognosis of the sepsis. Now, remember, in septic shock, there is refractory hypertension. The blood pressure may not respond to fluid. In that case, vasopressors are needed. The goal is to keep MAP greater than 65. Why MAP greater than 65? Because MAP greater than 65 is very important for the perfusion to the internal organs. And the first drug of choice is Levophed. The Levophed causes vasoconstriction, constrict the blood vessels. As a result, blood is shunted to the major organs, increases the cardiac output and increases the blood pressure. Now, there is inflammatory changes throughout the body. So steroids are administered as anti-inflammatory medicines. This patient are admitted in ICU. The patient will be on home hemodynamic monitoring. Example, they may have a central line, have a CVP, pulmonary capillary wedge pressure. This monitors the pressures on the right side and the left side of the heart. Patient should be on strict intake and output. Foley may be necessary to monitor the output of the patient. Now, in septic patient, monitor the blood glucose because the immune system can be affected by hypoglycemia. So patient may need an insulin drip. So today we learned about septic shock, and thanks for watching my video.